Welcome back to Washington Watch. I'm your host, Tony Perkins. So good to have you with us. Normalcy will continue to be delayed as President Trump extends social distancing guidelines through the month of April. Now, this was based upon a recommendation made by the task force. Now, what information made the task force make this recommendation? And also on Sunday, the FDA issued an emergency use authorization for two anti-malarial drugs for use in combating the coronavirus. Joining me now to talk about this is a key member of the task force, United States Secretary of Health and Human Services, Secretary Alex Azar. Secretary, welcome back to Washington Watch.
Tony, it's great to be with you and your listeners again. Thank you.
Well, I've been watching the task force briefings that have been taking place each day, and then Sunday, of course, the president making this new recommendation based upon what you and others have suggested to him. How did the modeling data that you had access to of the virus shape the decision to extend this social distancing, these guidelines through April?
Well, I think all of the different models that we're looking at, there's never one model that's perfect. It depends on the assumptions that the modeler puts into it. All of them suggest that we are not yet at the peak, and the president's 15 days to slow the spread is critical. It gave us those 15 days, but for us to actually see bending of the curve, because this has a 2-week incubation period on it, for us to see real slowing of progression, we need to unfortunately continue those types of social distancing, community mitigation behaviors longer. You know, we're still seeing a very stressful situation in the New York metropolitan area. We're seeing in Chicago, Detroit, New Orleans, southern Florida, we're seeing cases and rising cases that are of concern, and now would just not be the right time to let our feet up off the brakes.
So, Mr. Secretary, in New York, what we see unfolding there, which seems to be the most dramatic, of course, the most densely populated area to be hit thus far, are they kind of ahead of the rest of the nation? Are they a couple of weeks ahead?
Well, Tony, I think that's really going to be the dispositive question. Is New York and the New York metro area different from what we will experience elsewhere in the country? If we look at the epidemiological curves of every other community in the country that's experiencing cases, we see almost identical gentle sloping in terms of the increase of cases. New York is different. New York's quite different. Now, there are reasons, as you just mentioned, why New York might be different. They were a little later in getting to community mitigation efforts. It is a very densely populated, highly mobile community that spreads out over multiple counties and 3 states. So there are reasons why New York you might think would be different. The big test is going to be, do we see other New Yorks, or do other communities that get impacted look more like Seattle, where we're starting to see very real progress in flattening the progression of cases there?
Yeah, we've seen in my home state of Louisiana, in New Orleans, where that really mushroomed and spread out. Of course, that kind of linked back to Mardi Gras, another kind of almost international event where people come in, very similar to New York in terms of the influx and then the exit of people going elsewhere.
That's right, Tony, and there clearly is a very dominant role of European travel having seeded into our country across communities. So as you say, Mardi Gras there, New York as a commercial hub, as Europe was experiencing cases, whether asymptomatic or symptomatic, and then individuals in Europe or from Europe were bringing that into different communities into the United States. That clearly is one of the major seedings in our country. And so big events like Mardi Gras certainly would have been amenable to that.
So, Secretary Azar, is one of the challenges that those that are working on this, the task force and others, is that this is so new. We just don't know what it's going to do, how it's going to mutate, how it's going to play out. So there's a lot. The reason these guidelines and different things are changing is because more information is becoming available every day as experts study this.
Tony, that's right. We're learning more each day. Our experts are looking at what's happening in Italy, what's happening in Germany and Spain, what happened in China. I was just on with the Chinese health minister yesterday morning for an extensive discussion around what they've learned in the course of their dealing with the disease. I was just spent a lengthy discussion with the Canadian health minister today for her learnings on what they're doing and what we're doing. So we're really gathering information every day. One of the things that we are learning is just the increasing prevalence, or maybe not increasing, but unknown until more recently, just how prevalent what we would call asymptomatic carrying of this disease is. We do have a fairly substantial percent of people who will have this disease and not present symptoms. Still fully to be determined how transmissible it is from those individuals, but that's why this can be something of a silent virus and very, very difficult for us to tackle, even with the traditional public health tools of testing, diagnosis, isolation, and contact tracing.
So it's extremely important that people follow the guidelines that's being put out by state, local, and federal officials.
It really is. And listen, I'm the health secretary, and I'll tell you, for me and my family, it's very difficult. So I just want your listeners to know the president, everybody appreciates that this is a moment, a call for shared sacrifice. People are changing the day-to-day routine of their lives, and workers in particular are hurting, although the president working with Congress has brought significant economic relief to people. But these are challenging times, but they matter a great deal because the actions that you're taking protect you, they protect your family members, they protect your community, and frankly, in a time of great uncertainty and anxiety just from feeling disempowered, the fact that by staying at home, by controlling your routine, by keeping distance, that you can make a difference in your own protection of your own life, I find that quite empowering in a time of uncertainty.
Well, we can all do our part, and that's one of them. Follow the guidelines, and that's loving your neighbor by not exposing them and not carrying the virus around. Secretary Azar, as always, great to talk with you. Thanks so much. Appreciate the work that you and the rest of the task force is doing to try to keep Americans safe.
Thank you so much, Tony. Great to be with you.
All right, Secretary Alex Azar with the Department of Health and Human Services.